is they'll get a bunch of paperwork. And the whole purpose of the paperwork is to get to know the person better, know what's going on, what their challenges are, what their expectations are. So that way, during the visit, I can more focus in first on relieving some of the symptoms and then going into what to do to heal the body on a whole. So there's a lot of paperwork to complete, but the paperwork is very essential. I always say that it's good to complete all that paperwork because you don't want to come to the office visit trying to, and then I'm trying to learn about the person, trying to learn about the child, what the challenges are. So I'll spend so much time doing that. So if you give me the information or fill out all the paperwork before, then I personally review, study that information prior to coming to the visit, or in other words, I prepare for the visit. So that way, when you're in the visit, what we do is we talk about challenges and just give more information and things like that. So the first thing is completing all that paperwork and doing it truthfully because it's so helpful in getting to know the person. So the first visit, so that's the initial thing. Then during the office visit, we further go into the challenges. What are your challenges? Talk about autism or ADHD or anxiety or whatever the initial visit is for, what the possible etiology is, and what in that particular person or patient, very specific what we think is causing yours. And then we kind of go through the diet, initial diet, because diet is always involved. Food is medicine, so diet is always involved. So we go through dietary recommendations. So the first visit, on leaving the first visit, you'll have dietary recommendations. And then we'll go into all the different lab testing, general lab testing, such as labs that you do at LabCorp or Quest, and then specific specialized testing for hair analysis, urine testing, stool testing, food sensitivity testing. So that's like the foundation just to get a picture of what's going on with that person. So I always look at it this way. It's like looking at a building. You look at it from the front, the back, the sides, and you even go inside and look on the interior. So it's just getting the whole picture in order to make recommendations.
Okay. So basically, when the reason the paperwork is super important to fill out is so that you have as much information ahead of time, so that when the patient gets there, you can really focus all the time on explaining everything that's important in the program versus still collecting information.
Yes, and so I feel like I explain it as I want to be prepared. So I feel like it's to me it's a disservice if you come into an appointment and the provider you have to learn everything about you. They didn't get a chance to think about your situation, to maybe even do some more research about your situation and analyze everything that's going on. You're doing it right on the spot. So if you don't fill out the paperwork. So I think that doing that initial paperwork, and when I go to the meetings, I have all sorts of questions in my mind. For example, if you tell me that if one of the questions on this paperwork is whether they're sleeping through the night or not, do they have problems sleeping? So based on what you fill out, it will say, you say, yes, they're having problems sleeping, they're having problems falling asleep, or they're having problems staying asleep, or they're waking up too early. Then before I even get to the appointment, I have millions of things running through my mind, questions that I may, want to ask. And if I know, so I know initiating sleep is serotonin levels, and staying asleep is more related to GABA. So I want to know, okay, what supplements have you tried? So I want all that information. So all that I have already thought through prior to the appointment, so that way we could have a really broad discussion, and you're not just telling me stuff just telling me stuff. You spend your whole time telling me about these things instead of working on solutions, kind of
Okay.
thing.
And obviously your time is valuable, and these people are making a sizable investment into this. So the fact that you have more information up front allows you to get into your process a lot
Right.
more efficiently.
Exactly. So that way we can, yeah, I feel that way. Yes.
Okay. So quick question, when you say etiology, what can you break that down into a little more simple terms? Like how would a parent comprehend that?
Um, just etiology as what is causing the problem. So let me break that down. So autism, they always say if you see one autism person, you've seen one autism person. One person may come and say, okay, my son is having abdominal pain or constipation. And so now I got to figure out, what's causing it. Is it that, maybe that's not a good example. I'm trying to see a good example I could use to see etiology.
Okay.
Let me see.
So
Okay.
etiology is kind of like the
What's
whatever's
causing the
causing
problem?
the symptom.
Yes. And it could
So
be different. It's the same symptom. If someone say, okay, I have insomnia, but the cause could be different. So when I get a complete history, because when I go down, like for some of the things that I've seen or some of the situations that I've come across where it's insomnia, but the cause is different. So they tell me insomnia, they have a problem falling asleep. So sometimes I'll try something like GABA. And when I not GABA, I'll try something like melatonin, and then that will solve the problem. Sometimes that does not solve the problem. I'll say, okay, we'll do a detox bath before bed with magnesium, and that causes the body to relax. And then for some people, that will work because it was just that the person was kind of anxious. So, and then some people are having problems staying asleep. And I found even one child, they were having problems staying asleep is because they were hungry. They'd wake up in the middle of the night hungry. So when I review the diet, they were not getting enough protein. They were getting a lot of simple carbs. So I think that by the time they go to bed, like in the middle of the night, the blood sugar already went down because they were not getting a lot of complex carbs, a lot of protein. So they were waking up not because they had insomnia, but they were just hungry. So once we say, okay, let's change the diet, give more of a protein diet in the evening, and make sure they're full before they go to bed, um, then they weren't waking up anymore. So it's just kind of working through these things, and the more information that you have, instead of just saying, okay, insomnia, just take this.
yeah.
Um, you kind of work through and find out because each person, the word is the same, but for each person, it's the etiology, the cause is different.
Okay. So the etiology in your world is like the real root cause of the problem, not necessarily
Yes,
what's happening, but what's actually causing the symptom to happen.
yes. I don't know if I did a good job with that because I was,
No,
I was
that
trying to
makes
figure out the
that
right
makes perfect
example.
sense. Makes perfect sense. So okay, so
Yes.
let me ask you this. So I know there's like a go-to for blood work test that you highly recommend for your program. How do you come upon those four, and why do you feel so strongly about those four tests?
Okay, I my son had autism in 2015, right? So I have been to so many conferences. I've listened to all sorts of subspecialists from gastroenterology, neurology, genetics. I've listened to so many things and in trying to help my son. And so when I there's so many tests out there. There are hundreds. And if you're gonna try to, and a lot of times people will go on TikTok and they'll see a test and they're like, oh, that helped that person. I want to do that test. But I always say, for me, because I'm more internal medicine, I say, oh, do things in a systematic way. So you can't start off. It's like building a house. No, I'm not a builder. I can use
Yeah,
this example a lot. You
yeah.
can't start off with just putting the roof on. You don't have the foundation. You just start off with the foundation first, and then you build on it. So there are many tests out there, but first I want to look at the blood, because just general blood work, like looking at a comprehensive metabolic profile, and that looks at your liver, it looks at your kidneys, look at the electrolytes, and then general things like iron, like looking at your iron, hemoglobin levels. So I chose those basic tests because sometimes you can find so many things wrong. Like someone will come to me and they say, My child is just putting everything in their mouth. They're eating, dirt. They're eating a lot of ice, whatever. They're putting it in their mouth. And when they go to bed, they have a lot of time restless. They're kicking, moving around, can't seem to get a comfortable position. And they'll say, well, I don't want to get blood work because my child cannot tolerate a needle stick and it's going to be traumatic. But I will not go any further unless I get some blood work, because I have seen from my experience that I've done labs on someone and their hemoglobin is like 7. They have severe anemia. Their ferritin, which is a iron storage, is like 5. So it doesn't matter what I would have done, what sleep aid I would have done for that person with that restless legs, or what I might do to try to get them not to eat dirt and ice and all that stuff, having pica. It would not have worked because the problem was they had a iron deficiency. So I realized that the blood work, there's all those things that I do with the blood work. So I check the thyroids because sometimes they'll say, okay, they have fatigue, they seem tired, low energy. I want to look for any metabolic causes first before I go into give you supplements, is how I look at it. So that's why I look at all that labs and all those labs if I go copper deficiency, because if copper is low, then you're going to have problems making epinephrine and norepinephrine, which are neurotransmitters. And that neurotransmitters also goes into behavior problems, anxiety, OCD behaviors. All those are related to neurotransmitters. So I want to know the copper, your vitamin C, all the things that go into forming neurotransmitters and other chemicals or hormones in the body. So I need a complete blood work for that reason. And then the reason I look at the stool, I like to have a comprehensive stool analysis, is the gut. They said that all diseases start in the gut. So if I have a good picture of what the gut microbiome look like, are there parasites? Do you have zonulin levels are elevated, showing that there are problems at the tight junction? Do you have IgA elevated, showing that the immune response is up? Do you have all the different bacteria like bifidobacter, lactobacillus? What does that look like? So the stool gives you just the whole picture, the gut microbiome and what's going on. So I like that. And then the urine, it's an organic acid test. So it looks at the breakdown of different things like neurotransmitters, serotonin, and a lot of different things. It looks for mold metabolites, candida or yeast metabolites, clostridium products. So it's very comprehensive, and I could go on going on.
Yeah.
And then the hair, these are very, very good informative tests. So if I feel like if I have the urine looking at all those metabolites, I have the stool looking at the gut microbiome, and the hair looks at mineral levels and heavy metals. So it kind of gives you, okay, is this person mineral depleted? Do they have even the iron? It will show you the mineral. So you could say, okay, when I'm doing the vitamin supplements, this is the protocol, or this is a set of supplements I want to use based on what I see the mineral. If you have selenium is low, all those little things. Selenium is needed for the thyroid. So if you can get the picture, how I kind of lump everything together. So when I get the stool, the urine, the hair sample, and then I do a food sensitivity test looking at IgG food sensitivity, which some people will say, well, it's not the greatest test, but it's helpful. So I will get all those 4 tests, and based on that, you could see how based on the lab work and getting those 4 tests, you could really make a foundational plan for someone.
Okay, so you're in your expert experience of going and analyzing all these tests that are out there in the universe, you're confident that these 4 you feel really give you the tools that you need to help people.
It does give me the tool I need to help people.
Yeah, and doing the labs, like you said, with certain behavioral characteristics, that allows you to pinpoint the treatment a lot more specifically, correct?
Yes, it does.
Okay. So when the labs are done, the first meeting is over, they're going to come back and meet with you another time to go through the labs. Walk me through what goes through that process.
Okay, so we mentioned all those 4 basic foundational labs, and then we mentioned the labs at the general labs like Quest or LabCorp. So once that is done, once you get the labs done, then normally they send me the results. Through our patient portal, I share every result. So once I get it, the patient has it as well because I share it on the portal because I want them to kind of look through it. And I'll say when I send it, I said, this is for just for your review. So that way when we meet, then any questions you have, we could go over everything and understanding. But if there's something that's very wrong, if I see there's an abnormality that's just very wrong and like an emergency, then I'll send it, but I'm also gonna call because I need to take care of whatever is going on now. If I need to take care of it, or I need to do a referral or whatever. So if there are certain labs that you can do, and if there's an emergency, then which I've seen example if I do a stool sample and it comes back that the person has salmonella, then or any sort of infection like that, then I'm gonna have to pick up the phone and call and find out what symptoms are they have. Did they know they have this? Did they go to the doctor, or that kind of thing. So for emergencies, I'll call. But other than that, what I'll do is I'll send all the information. I'll let you know I've reviewed it and just go over. And once we gather all of them, all four tests, everything comes back, then we'll meet again, whether virtual or in person, and we'll go through every result. So I'll explain because just like me talking to you now, not everyone, I mean, people look at it and they said, I look at it, but I have no clue. So I feel like for someone to do better, it's better to understand why you're doing what you're doing. So it takes an hour and a half because I go through every single thing. I go through every abnormality. And if we have time, I'll show you data. We'll go to PubMed and I'll pull up articles and I'll show you what's researched and why, what they found and this and that. And then why I do this treatment plan, because I really believe that if you understand and know that I'm not just picking this up out of my head,
Yeah.
it is something that based on experience and research, and then I'm looking for your feedback to see what happens with your child with it. So this takes really about an hour and a half, even 2 hours to go through every single thing and then come up with, okay, all these are what I found that are the abnormalities. All these things need to be treated or need to be addressed. How are we going to do it? Let's start with just this and then do this first, because you can't do all of it at the same time. And then we'll come back and then go the next phase. So that's what we do on the second meeting.
Okay. So once they complete that, they have a pretty good idea of like where the gaps are, things that
Yes.
they can do to fill in the gaps based on your
Yes.
recommendation. In your opinion, why is the continual coaching important over like a year to 2 year period for them to keep meeting with you? Maybe walk me through that, the importance of that process in your opinion.
Yeah, and this only came by from experience because first, when I just started, I would do the lab, we'll come back, we'll go through it, and I would make this long list of every single thing that's wrong on the hair analysis and what the treatment is, everything that's wrong on the urine and what the treatment is, and then everything that's wrong on the blood, and then I'll give you these 2, 3 pages of okay, these are all the things you should do, and then I'll order all the links, all the supplements, these are all the things. But then what I realized from doing it that way, it's from trial and error, is that they'll go home. Number one, it's overwhelming. It seems confusing, and some people they just feel like they can't do it because it's so much. And so that's one problem that happened. And then some people say they start one supplement, say they start 5-HTP, which is a precursor to serotonin, and it's supposed to calm you down. But then they have problem, they started falling asleep or they get hyper. Then the plan doesn't really tell you what to do next because it didn't go as planned. So what do you do next? So I find that, and that's just one thing. Or they start the antibiotic or whatever for this infection in the bowels, and then there's something else popped up. They started getting a rash all over, and so I realized that it for to do it that way, if it's not a medical person that knows, okay, what am I going to do when this happens? I don't know what's going to happen with each person. It's different for each person then it's hard to just give you this tool list and say, now here you go do this. It didn't work out. So I find that we all know what the treatment plan is. We all have these 2 pages, but we all decide we're only going to do this 3 here and then see what the response is. We'll meet up again. What happened when this happened? Did he get better or did she get better? Did she get worse? I mean, did she have a rash or what happened? And then based on that, I'll say, okay, let's pull back or let's implement this or let's add this on. So I feel like it's one of those things that it's in progress. It's not like just one size fit all kind of thing. You have to work with it, even though the results and the protocols, whatever, can be, can be like just a protocol, but each person is so different working with the protocol.
Okay, gotcha. So you have to get the program set up. You have to start getting the feedback on their side to see
Right.
what's happening, and then you can make your adjustments based off the feedback. But if there's no feedback, it's hard to make adjustments.
It's hard to make adjustments, and if 2-3 months later you're coming to tell me, oh, this happened, and then I'm like, well, why didn't you tell me? Because that's not working. But they didn't know that was not what's supposed to happen, and so then we've lost 3 months.
Yeah.
because you didn't know, or sometimes I find that I say something but someone hears something else and I'm like, oh wow, I when I said gluten free, dairy free, soy free, you told me now you went to the store and you get all these processed stuff. Then now it's so the diet, you still didn't get the diet because that's not really what I meant. So sometimes when it's all that information, what they hear and what I am saying and what they hear are very different. So, but if I saw you in the next 2 weeks or another month, and I get normally during the follow up, I want to know exactly what happened, and that's why initially I say get a notebook because this is a team effort. I don't think one person can do this by themselves. It's a team effort because you're seeing it's your child, you're seeing a child 24/7, so you know everything that's going on. I'm only seeing the child probably 1 hour or even less a month or every 2 months, so I want to know everything that's going on. So when you collect all this data, then definitely it's easier to make adjustments or to see what to do next.
Okay, perfect. Can you give me a couple of examples that you, with your own child, that you did the research, you implemented it, you saw that these were working, this wasn't working? Maybe give me examples of a couple adjustments that you did that you then saw benefits from.
Okay. All right, let me think about that. There's so many different things going through my mind.
And maybe the ones that are the most profound, like as you came across these profound discoveries and then you implemented them, like, wow, that really worked. Maybe if there's like 2 to 3 that you can think back on that really were game changers.
Okay. So a big thing for my son I noticed was he had severe constipation. Initially, when he was first diagnosed, I didn't think much of it, but he had severe constipation in that he would only go to the bathroom, have a bowel movement maybe once a week, once every 3-4 days. And I noticed that when he did not have a bowel movement, so we had speech therapy, occupational therapy, ABA. So when he didn't go to the bathroom for 3, 4, 5 days, then I noticed the behavior was really bad. So he'd go to speech therapy and he can't sit. He's all over the place. He's under the table. Everything is just everywhere, and it's just hard to control it. ABA, same thing. OT, same thing. Banging his head on the stairs. All these behavior issues. So after dealing with that for a little while, I kind of put 2 and 2 together and say that maybe because he was nonverbal, he could not tell me that he was having pain in his belly from not having a bowel movement all these days. So what I did was I started giving him magnesium citrate. I started giving him supplements and I started documenting bowel movements when he had bowel movements every day. I noticed when he was having bowel movements every day, behavior was a lot better. He was calmer. He seemed more focused. He seemed able to do his therapies a lot better. So constipation, I realized that constipation was a big factor. I think it's because number one, I took pictures of his belly, how distended it was. I think it was causing some pain. And I think if the stool is just sitting in your colon, you're reabsorbing toxins, and toxins can affect the brain functions. I think that was what was going on. So it was just seemed to be in brain fog, seemed to be in a daze all the time. So I really had to work on constipation. I think those two are very related. And I think sometimes when you go to speech therapy or any other therapy, they're not asking, they just report the behavior, but they are not really connected and say, well, what happened last week? I mean, is he sleeping? Is he having bowel movements? You know, what was their dietary change or those kind of things. So that kind of lead me into believing, okay, the gut is I have to make sure daily bowel movements. I have to make sure he has daily bowel movements. Whatever, giving aloe vera juice or magnesium citrate or even using essential oils or magnesium bath, Epsom salt bath. But I had and sometimes one thing wasn't working, so I had a bunch of things going on at the same time to make sure that we're having daily bowel movements. And if that didn't happen, I bought one of those enema bags that you put the water in, and I do the enema. I do it's even just a tap water enema, using filtered water I would do. But I noticed that bowel movement behavior there's a strong correlation. So I made sure that bowel movements were done.
Okay, so when you got the bowel movements cleared up, you could see the difference in the
I see the
behavior.
difference in behavior, yes.
Okay.
And the therapist also noted because that there was an improvement in behavior. They were able to sit still more and they were more focused.
Is that pretty typical symptom in a lot of the kids that you see for
Yes,
autism?
yes. So it's
Okay.
and I've had mothers tell me that once we got the bowel movement and the diet, that the teacher was like, it's a totally different person. So I think that constipation, pain from that, or food. There are certain foods, because another example is dietary change. When I pulled out dairy and gluten from the diet, because he used to be so hypertensive, still running around. And once I pulled out certain foods like the dairy and the gluten from the diet, then he calmed down a lot. So I realized that what he eats was related to behavior as well. So I tied all these things into behavior.
Okay. So two big ones for you were the getting the bowel movements regular, and then cleaning up the diet in the way of like
Yes,
processed food and the dairy.
yes.
Okay. Perfect. Okay. I